All right, well, can you see that okay? I hope that's in good shape.
Yes, sir.
All right. Hey, thank you very much to Boehringer for sponsoring this session. And I do want to extend my sincere compliments to the Applied Reproductive Strategies Task Force. I think this is a tremendous group and has made such important extension activities for our cattle producers. So tonight I'm really pleased to share with you some research, but also some philosophy on how best to vaccinate cattle to protect against reproductive diseases, specifically as it relates to the viruses. Here at Auburn, we do a fair amount of research related to vaccines, but also related to bovine herpes virus and bovine viral diarrhea virus, which are two of the most important viral pathogens that we actually have in our cattle. All right, so just real quickly, as you know, BVD is such an important disease. If you look at all of the clinical syndromes associated with the virus, there's quite a few. Acute infection, which is probably better termed transient infection, because those generally are cattle that will overcome the virus, mount an immune response, and go on and do quite well. Occasionally, we have some strains of the virus that really are hot, that can create disease and create death, but the majority of our transient infections are subclinical, lacking observable clinical disease. The most important aspect of BVD, obviously, is the fetal infection, so the infection of the pregnant cow. And within that realm of infections, the generation of persistent infection there at the bottom is really the most important aspect. And the persistently infected carrier is the key to all of our BVD control efforts. And as we talk about vaccination, we really need to be thinking about ways to optimize immunity in the pregnant cows such that the virus can't cross the placental barrier and infect that fetus and create persistence. That's really how we want to control this virus. So controlling BVD involves a three-pronged approach: diagnostics, and basically that is, we've got excellent diagnostic assays, and basically identifying and eliminating persistently infected carriers is really important. That's one prong to the approach. The persistently infected calf is the key to all BVD control measures. Immunization through vaccination, so we can get high levels of immunity in those animals to prevent that virus from infecting and crossing the placenta is also another important control strategy. And then finally, biosecurity, preventing the introduction of the virus. I can't tell you how many beef cattle herds I've investigated, and dairy cattle herds as well, where I've investigated, we've done a lot of diagnostic testing, spent money, cleaned it up, but then it was reintroduced mainly through the purchase of pregnant heifers where the status of the fetus is unknown. The whole Trojan cow phenomena. There's actually some recent research out of the United Kingdom that actually states that purchasing pregnant females where the status of the fetus is unknown is the #1 method of bringing BVD onto a cattle operation. So that's where biosecurity is really important. Of course, IBR virus, or bovine alpha herpes virus 1, is the other virus that's very important. And it's a herpes, so it's a DNA virus, and it also has acute and transient infections, and that's where we see a lot of our placentitis and abortion and reproductive effects with that as well. Of course, we also think about IBR as being part of the bovine respiratory disease complex. And don't underestimate the importance of IBR as a cause of ocular disease, whether it be conjunctivitis or corneal disease as well. So it also has, like BVD, a multisystemic format of disease. What is really kind of interesting is how this virus perpetuates in cattle population as opposed to BVD. BVD is persistently infected carriers. Herpes viruses like to establish latency, and essentially that's where the virus resides in the nucleus of mainly nervous system cells in an episomal, so it's in the nucleus, but in a circular fashion, and with these latency associated transcripts, it prevents the virus being recognized by the immune system, and so it's it's a pretty cool way of surviving in an animal, and it really has adapted itself well to survive. But that's the real problem, is that when that virus then becomes reactivated, we can have problems in herds from a reproductive standpoint. And so when you look at herpes virus, we use some of the same techniques. Of course, we rely a lot more on immunization for herpes viruses than what we do in terms of identifying and eliminating latently infected animals. There's just not a great way, and nor is it cost feasible to identify latently infected animals and get rid of them. So herpes viruses are much more difficult to control because of that inability to find those carriers. And of course, biosecurity is really important. If you have a latently infected animal, the stress of shipping will certainly cause recrudescence and disease. As you know, we've got lots of options for vaccination. The options are quite large. We have in the United States currently the ability to use modified live or inactivated viral containing vaccines. But really, if you look at those, there's benefits and there's demerits of each class of vaccine. With modified live, we do get good cell-mediated immunity. We have the ability for a basic immunization to occur just with one dose, but we don't have the safety because these are strains that are attenuated. They're not necessarily, free from the ability to induce disease. That's an important concept. Versus inactivated vaccines, we have to have 2 doses to get that basic immunization. But because they're inactivated and we're providing the antigenic mass, Dr. Chris Chase is really been on the forefront of that discussion about antigenic mass. I think that's a wonderful topic. With killed vaccines, we do provide that antigenic mass to stimulate primarily humoral immunity rather than cell-mediated immunity. I think you're going to see this theme a lot in this lecture, and this is a theme that really we've been stressing as a cattle raising community for years now. With our reproductive vaccines, when you use those, either modified live or inactivated fractions, there really is a balancing act between having something that's safe and something that is very effective or efficacious. And Dr. Scholle Falkenberg at USDA, I think, has coined the phrase very well. You kind of get out what you put in, and that's an important. And I'm going to show you, we're going to walk through some of the data. Modified lives are generally not as safe, obviously, as inactivated, and inactivated viral vaccines are not as efficacious as modified live, and it becomes an exercise in risk. And that's the very last thing I want to talk about at the end of this talk, is this exercise in risk that we all need to do as veterinarians working with our producers, or even as producers who are on the line. It's an exercise in risk and where you want to put your risk when you're using these products. There are safety concerns. So let's talk about safety first. There are obvious safety concerns with the use of these multivalent modified live viral containing vaccines. And it doesn't matter which one it is. Most of the modified lives do have attenuated strains of bovine herpes virus, as well as attenuated strains of BVD virus. And we know those attenuated strains have the potential to induce abortion. BVD vaccines contain cytopathic strains, but cytopathic strains can induce abortion like non-cytopathics can. The only difference there is the generation of persistently infected carriers. With herpes virus, attenuated strains can also cause abortion and fertility as well. And so these are some real risks associated with the use of multivalent modified live vaccines, especially when they're used in situations where they're going to induce these safety issues. This is an older study, but I really like to show this because we have known about the effects of modified live viral vaccines on infertility for a long, long time. This was a study done, in the late 1980s at Auburn University. Dr. David Stringfellow was the senior author on this manuscript. And they actually showed when you gave modified live IBR vaccines, you did induce reproductive inefficiency in cattle if they're vaccinated at or around the time of estrus. Of course, Dr. George Perry, who's a really key member of this council, this task force, has done some excellent work where when you administered modified live viral containing vaccines in naive cattle within estrus synchronization programs, there is a great potential to reduce fertility. And here's the key findings and the key phrases that many of us have observed with the use of modified live vaccines in populations of breeding heifers, is that if they are truly naive and they're receiving modified lives in close time proximity to breeding, you greatly increase the likelihood of seeing problems. Versus a revaccination event will reduce that effect because the immunity acquired from prior vaccination. So it really comes down to how well the animals are vaccinated prior to, or immunized. I should use the term immunized because vaccination and immunization are different terms, but how well they're immunized prior to the immunization in close time proximity to breeding. That's the key point. We've done a lot of fetal protection studies at Auburn, and this is just one example of those. This was a study done by our extension veterinarian here at Auburn, Dr. Soren Rodney, where he actually looked at different vaccine protocols, compared an all-killed versus 2 different modified live vaccines. And when you look at, whenever we do an efficacy study, we're also doing a safety study at the same time because we're looking at the fertility of those animals before we challenge them with BVD. And so this was never published in a manuscript, but this is an example of where cattle that have been immunized, vaccinated 4 times prior to breeding, had no difference in their pregnancy rates, with a timed AI and a bull breeding program. So it does emphasize how important it is to get these animals properly immunized before that shot given right before breeding. We did a study, it's been published in Therio, and this is an excellent study because it kind of highlights some really important concepts. So this study was funded by Boehringer Ingelheim, and of course we're very grateful to them for sponsoring this session. This particular study looked at pregnancy rates in heifers that had been revaccinated. So they received a vaccine at the time of enrollment in the study when they were in estrus. So we were able to look at interestrus intervals, which I'm not going to show here. But then they were revaccinated either at 10 days prior to breeding or at 31 days prior to breeding. And so that's the basis of the study. The revaccination was administered at either 10 days prior to breeding or at 31 days prior to breeding. And so group A there that you see here at the very top, group A is a group that was administered that second vaccine at 10 days prior to breeding. Group B were the controls. Group C were the group that received a modified live vaccine at 31 days prior to breeding. So although there weren't any statistical differences between the groups, there was a numeric difference. And what we saw that by the end of the study, there were less numbers of animals that were pregnant in that group that received the dose at 10 days prior compared to the controls or the dose or the group that received it at 31 days prior. Again, I want to emphasize it's not statistically significant, but it was numerically significant. What we saw in this particular case is that we actually had equal numbers of animals that were pregnant within that first 5 days of the breeding season. So there's a bit more in the study that I should tell you about, but we just don't have time. And you can read the manuscript, but these animals were subjected to a synchronization program, and then we actually used a bull breeding program. And so these are the animals that got pregnant in the first 5 days of the breeding season. There was no difference there, but what we saw is that in the subsequent breeds, we had more of the controls and the group C that became impregnant. And that's what this graphically shows here in this particular study. You had more of the later breedings with the controls compared to the 31-day and the 10-day. We also looked at ovarian tissue and the concepti from some of these, the conceptus from some of these. We didn't find any virus, either BVD or herpes virus in that group. And so what is an important observation from this study is that the greater time that we can put modified lives in before breeding, the better off we are. I think there's mounting data sets that would suggest keeping modified lives at least 28 days before breeding is a wise choice, and even putting it 42 days to have multiple cycles, or 45 days to have multiple cycles in between that modified live dose and that time of first breeding really is an optimal thing. The other safety concern associated with modified live vaccines is abortions. And we know, and we've always known, that when you take naive cattle and you put a modified live in those naive pregnant cattle, there is a risk of aborting those fetuses. But what we found, what the community has found in the last 10 years or so, is that we're starting to see a few more of these in what would be referred to as well-vaccinated herds. And so this particular article was written in JABMA. It was written by the group, Dr. Donald O'Toole out of Wyoming, where they identified aborted fetuses from a herd that would have fallen under a routine vaccination program. The problem back then is that it was very difficult to differentiate a vaccine-induced abortion from a natural-induced abortion. But I will tell you, thanks to Dr. Robert Fulton at Oklahoma State, we're starting to get really good primer sets and data sets where we can start looking at differences of herpes viruses strains that may induce that. But what should really guide us in using modified live vaccines? And obviously it's the label. Our companies do an outstanding job of providing data driven by research on efficacy as well as safety of vaccines. And so we really should look at the label. And the label will tell you, even if it has a safe to use in pregnant cows claim, if you look at the claims very carefully, you have to follow the letter of the label and make sure you're using the products according to the label, because the data generated supports the use of that label. And so, again, do not use in pregnant cows unless they are vaccinated according to label directions with whatever vaccine that has that fetal protection claim within the past 12 months. Do not use in calves nursing pregnant cows unless their dams were vaccinated within 12 months as described. And heifers must receive at least 2 doses, with a second dose administered 30 days prior to breeding. So follow the label. I will tell you that it appears that virgin heifers are much more sensitive to both the fertility effects as well as the abortifacient effects of these modified live vaccines. It really are the developing heifers that bear the brunt of the disease, or bear the brunt of the effects related to safety. All of this was made possible because the Veterinary Services Memorandum 800.110, and you can search this and you can look for it. It's a 4-page document, and it's an excellent document to review because it describes the process by which vaccines gain the label for safe to use in pregnant cows. But even then, there still has to be this warning statement on those vaccines. And read this warning statement very carefully. Fetal health risk associated with vaccination of pregnant animals with this vaccine cannot be unequivocally determined during clinical trials conducted for licensure. What that means is that even in well-vaccinated according to label, there still is a potential. There still is a risk of abortion with the use of these products. And again, we should be risk averse. It's all about an exercise in risk in using these products. And again, I think we owe a lot of credit to Dr. O'Toole for some of his writings, and I think this is one that I certainly agree with, that We need to make sure producers are alert to the effects that vaccines, attenuated modified live vaccines, have the ability to induce fetal problems and reproductive loss. All right, let's turn our attention real quickly to efficacy, because efficacy is the other side of that balance statement. We want vaccines that are highly efficacious. Dr. Benjamin Newcomer, a colleague of mine here at Auburn, he's now on his way to Texas A&M. So the Texas A&M is getting a really great researcher. But he did a meta-analysis, and a meta-analysis is essentially a compilation of multiple randomized clinical trials to increase the strength of data or the power of the observations. And so he published a meta-analysis on efficacy of BVD virus-containing vaccines. And so some really important work. And in this meta-analysis, the observation was that the use of vaccines in general reduces the risk of BVD fetal infection to 0.15. And this is called a forest plot here. And so basically this forest plot, a value of 1 would indicate no benefit or no detriment. And you can see that the majority of these studies, except for one, are pushed to the left. There's a few studies that are right here on that line, but the majority of the studies are pushed to the left, meaning that they reduce the risk of fetal infection. And when you compile all that, we reduce it down to 0.15, which is essentially roughly a 7-fold reduction in risk. Our vaccines are highly efficacious. If we can reduce the risk of fetal infection 7-fold, that's a tremendous reduction in risk. So our vaccines are very efficacious. But there were some interesting observations, and these observations could only be made because we had a fair number of studies that went into this meta-analysis. And so when you look at the overall effect, again, the risk ratio is reduced. But when you compare modified live to inactivated containing vaccines, you can see there that the reduction in risk is much greater with modified lives than with inactivated. So that's a difference of 0.1 versus a difference of 0.2. A reduction of 0.1 is nearly a 10-fold reduction in risk versus a reduction of 0.2 is a 5-fold reduction in risk. So let's dissect that a little bit. Killed vaccines are also very efficacious. They are just not as efficacious as modified live viral containing vaccines at reducing the risk of fetal infection, which persistent infection is part of that fetal infection complex. So I'm honestly telling you that vaccination is efficacious against BVD, both killed viral vaccines and modified live. Modified live viral vaccines are more efficacious. The data strongly support that. Am I telling you that they're 100% efficacious? Absolutely not. We know that our vaccines reduce the likelihood of fetal infection. They don't eliminate the possibility of fetal infection. There's a tremendous difference between infection and disease. We have cattle that might be vaccinated that don't get diseased, but they still have the potential to get infected. Any serum viremia or cell-associated viremia induces the potential for that virus to gain access to the placenta, cross it, infect that fetus. So we have to understand what our vaccines can and cannot do. They cannot prevent 100% of the infections. They can reduce the likelihood tremendously. Highly efficacious. Looking at our herpes virus vaccines, Dr. Newcomer did another excellent study, a meta-analysis looking at bovine herpes virus vaccines. And this is one, there's just not as many clinical trials. So the data are not as strong with herpes virus efficacy data. But here you can also see with the studies that involved an intentional herpes virus challenge, where animals were actually challenge exposed to bovine alpha herpes virus 1, we also see a great reduction in risk. So even our herpes virus vaccines are efficacious. There were not enough studies to make statements on differences in efficacy between killed and modified live. All right, let's talk about programs. So, If you've never seen this study, and I think this is a group that should reconvene, Dr. Dan Grooms, who's actually the dean at Iowa State, was the lead author on this in the Bovine Practitioner. If you've never read this article, you should. This is I think one of the most concise reviews ever on how best to control BVD in beef cattle operations. An outstanding, excellent article. And basically, and I'm not telling you anything new, vaccination works really well. You get the best protection when you use the best products and they're administered at the best times. And so we've got really good data sets that would say that the most reliable method of developing heifers to prevent reproductive losses is to get them 2 doses of modified live virus containing vaccines, with that second dose administered at least 30 days. And we might even recommend that 45 days to get 2 estrus cycles in there between that dose and the time of breeding. That is the most reliable method. What isn't a reliable method that we all know, and unfortunately it still happens today, is the use of a single dose of kill. A single dose of kill is really not recommended as a method for immunizing heifers. How we manage our heifers sets them up for the rest of their life. And we really have to pay attention. If we could pick one day where the sun is shining and the birds are singing to work cattle, it's when we're vaccinating our virgin heifers prior to breeding. That's the day we want all the stars to line up and everything to work perfectly, no stress, so that they can mount an immune response and be protected. This, I think, is the best chart of all because it really gives a comprehensive picture of how best to immunize your heifers, which is there on the right-hand side of the screen, using initial vaccination of heifers with either modified live or killed, 1 or 2 doses, and then how we handle those cows after they've calved. So this is the revaccination plan of the mature cow herd. And again, you can see a strong reliance, a strong reliability on modified live protocols, especially protocols that involve the cow herd prior to breeding with 2 doses of modified live given to those virgin heifers with that second dose at least 30 days prior to breeding. This is the most optimum method. We did a study where we actually looked at taking the best aspects of the modified live viral containing vaccines and combine them with the safety aspects of the killed virus vaccine. And so this was a study that was published in Vaccine. Hopefully many of you have seen this. This was a study that was sponsored by Zoetis Animal Health. And it really was looking at using a booster which contained inactivated fractions of BVD in pregnant animals that had been primed as virgin heifers with modified live vaccine. And so basically this particular study was a study that compared number 10, vaccine protocol number 10, which is 2 doses of modified live as heifers, and then a post-breeding shot of killed, which was pregnancy check using killed, and comparing it to pregnancy check using a modified live. So we compared protocol 10 and protocol 11 in this particular study. And our objective was to compare that protection against both of these 2 viruses with an annual revaccination of either modified live or a combination, a hybrid vaccine, because we used Cattle Master, which contains a temperature-sensitive mutant of IBR. Again, using modified lives where they really show some benefit is in that immunization of the heifers. This was a 3-year study. It was one of our most challenging studies. But we took the calves, we vaccinated them with 2 doses of modified live. We had a control group. We did a reproductive timed AI, estrus synchronization, timed AI, and a bull breeding. We pregnancy checked them, and then we revaccinated them roughly at the time of pregnancy check. We then allowed them to calve. We then did another timed AI, estrus synchronization, timed AI program. We then exposed them to BVDs, which is during this critical period of pregnancy when PI animals are generated. And so that was, not quite a year after this dose of vaccine. We then boosted them again according to their group, and then we challenged them with IBR. So this was a dual challenge of both BVD and IBR. Really some observations that I thought were quite interesting. One is that in those cows that calved for the first time, again, we had heifers that went calving for the first time. Some had received a booster dose of inactivated fractions of BVD. Some received a booster dose of modified live. And what we found was actually that the calves born from the heifers that had been vaccinated with the Cattle Master Gold, which was the inactivated fractions of BVD, actually had higher colostral transfer of antibodies compared to those that were dosed with the modified live. This is something I think we really need to look at in greater detail as a community, because this might be an avenue for enhancing immunity in those calves and maybe preventing some of those summer respiratory cases. Again, this is just the components of the different vaccines. This is the titer data. I always usually present titer data at the end, but the titer data was just so interesting in this case. So this is titer is against NADL, which is a BVD type 1A strain. And you can see, and this was not really what we expected, but you can see the higher titers, statistically significant differences in antibody titers in the group that received Cattle Master at booster compared to those that received Bovishield at booster. And then, of course, we did the BVD PI exposure. We had a rise in titer as would be expected, and then we did the IBR titer. Same thing with the type 2s. We saw a real high titer. What was interesting is what we saw with the bovine herpes virus, and this has been shown in a couple studies now, that when you take a inactivated or a killed fraction or even a temperature sensitive mutant as a boost dose after heifers have been immunized, you get a much higher anamnestic response to bovine herpes virus. And this is antibodies. Remember, antibodies aren't that important for herpes virus. Cell-mediated immunity is much more important for herpes viruses than what humoral immunity is. And with BVD, we really like to rely on both cell-mediated and humoral immunity to control BVD. But really, what was interesting to us is that the titers after that first vaccination with the temperature-sensitive mutants was as high as the after the challenge with IBR. So I think this is something that I hope other companies are looking at as well. We did our BVD PI challenge, and what we do at Auburn is we usually like to put persistently infected carriers into the pen with the vaccinated animals. And so we like to use a ratio of 1 PI per 10 pregnant fetuses. So already, hopefully you know that this is a very rigorous challenge. If a vaccine is 100% protective in our challenge models, that's a good vaccine, because we really put the virus to those cows. And so as you can see here, we use 2 type 2 strains, 2 type 1A strains, and 2 type 1B strains in our PI challenges. These animals were shedding 5 and 6 logs of virus from their nasal swabs at the time that they went into the pen with the pregnant heifers. And then they were shedding that same amount, 5 and 6 logs. So this is typical of PI animals. They shed very large volumes of virus. They're highly infectious. In contrast, an acutely infected animal may get at best 2 or 3 logs. Sometimes with some highly virulent type 2s, they may get 4 or 5 logs. But PI animals really are immunotolerant, and they're shedding large numbers of viral particles. And so they're excellent challenge methods. So here's some of the data I want to go over. So these boxes indicate an individual cow. A white box is where we could not detect BVD. A blue box is where we detected BVD out of a group A animal. Remember, the group A animals were actually animals that had been boosted with modified live. Yellow is from group B. Those were animals that were boosted with the killed fractions of BVD, so a killed booster. And then the reds are the controls. And so you can see both from the white blood cells, where we find a lot of virus, compared to the serum, where we don't find nearly as much virus. And this is the effect of vaccination. The vaccination does damp the amount of virus in the serum. but we still occasionally will have these breakthroughs. We have these viremias even in cattle that are vaccinated. Same thing with IBR, the same kind of scenario. Each box was a cow. We did have 3 of our cattle that were boosted with the modified live. They were viremic for herpes virus. We did have actually more of the ones that were boosted with the cattle master, had a nasal swab positivity rate, and then this is the controls. But here's the important data, because serum viremias, white blood cell viremias really don't matter. What really matters is whether that virus, either of those viruses, crossed the placenta and infected those fetuses. And this is the data here. And so a little a is an aborted fetus after BVD, but prior to IBR. A capital A is an aborted fetus after both viruses, so after the IBR. A C is a live-born calf. And so as you can see already, in the control group, we had the majority of them abort. And the majority of these abortions were PI animals that were aborted because of the IBR. That's what black is down here at the bottom, is an aborted fetus where we picked up both viruses. A live-born calf, we had 4 live-born PIs in our control group. We had 1 fetus that aborted that wasn't positive for BVD in the control group. But looking at the data, again, I want you to focus here in the very bottom. Group A is the group that had been vaccinated with 2 doses of modified live prior to breeding and then given a modified live at pregnancy check, versus group B was immunized with 2 doses of modified live prior to breeding and then given a killed BVD and a temperature sensitive mutant of IBR at the time of pregnancy check. And so you can see that we had 0 infections with herpes virus, 0 infections with bovine viral diarrhea virus when we used cattle master to boost the Bovishield versus using Bovishield as the method. Now, these data were not statistically significant, and that's an important thing in the world of science and research, statistically significant and relevant outcomes. So abortions and PI calves are highly relevant outcomes. But there's also a biological significance. When you have 1 PI calf born out of 100 pregnant cows, that's a biologically significant event. And because a PI animal certainly can shed virus to other animals. So we have to think in terms of both statistical significance and biological significance. And this is just a summary of that data. So this is the first study that really showed that you can take advantage of the merits of inactivated fractions, inactivated viral containing vaccines, but also use the benefits of those modified lives from an efficacious standpoint. There's still some data that we need to generate. So this is just one manufacturer vaccine, one group of vaccines. We don't know if we get the same data with other vaccine lines with different fractions, different strains. We don't know if we can mix and match vaccines. There are no data to support any of those recommendations. So we do need more data. We also need some data on the cow herd, because if we transition our cow herds to an all-killed program, we certainly have to look at those cows several years down the line and what their protection might be. But this is the first step, and I think this is an excellent first step in looking at immunity generated using the strategic advantages of modified live and the strategic advantages of inactivated vaccines. The other thing this showed, again, if you go back to the original data set there, it shows that even using modified live at pregnancy check certainly reduces the risk of fetal infection in our model substantially. There was a statistically significant difference, a significant reduction in abortion and PI rates in those that even received modified live at pregnancy check. So if it's working for you, you don't need to change. If using an all modified live program is working for you, you don't need to change. Again, summary recommendations, I think it's a critical point. Just because you inject an animal with a vaccine doesn't mean they're going to get immunized. And it certainly doesn't mean that you're going to prevent infection. And our as veterinarians, we got to make sure our producers understand that. And for the producers in the audience, you've got to understand where the value of vaccination is and how best to achieve it. So we really want to use those vaccines to the best of our ability. So I've come to the end, and here's where I really want to finish up. And vaccination and reproductive diseases are really an exercise in reducing risk. And so I think all of us at one time in our lives have played the board game Risk. The more troops you put in, the greater chance you are to win that country, but also the greater chance you have to lose all your troops. And so we can take that analogy and apply it to our vaccine programs. If you are a producer or you're a veterinarian that works with producers who participate in what we call risky behaviors, which include purchasing stocker calves and putting them next to pregnant cattle, purchasing pregnant replacement females, not having good fences, not monitoring who comes on and off the farm. If you have risky behaviors in your herd, you may want to consider, with the help of your veterinarian, or if you're a veterinarian in the audience, consider having that discussion with your clients to lean on the side of using highly efficacious modified lives. If you have excellent biosecurity in place and you've done screening of aborted fetuses and you haven't found persistently infected carriers, you don't find herpes virus in aborted fetuses, you have good pregnancy rates, you have good calving rates based upon the pregnancy data, you have that ability to err on the side of safety and not be as risky using modified lives in pregnant animals. And of course, the old adage is always there. If it ain't broke, you don't need to fix it. And so I'll leave you with that. I think it's really important, again, to think about the merits of our modified lives, the merits of our kills, and apply them strategically to maximize safety and efficacy.
Great, thank you, Dr. Walz. Excellent, excellent presentation and kind of a comprehensive approach, and then an update on some data you guys have done down there at Auburn. So thank you for that. We do have a couple of questions that I'd like to get to and have time for those. So one of the questions is really in relation to safety, and it's kind of a two-part question I'm going to ask here, Dr. Walz. Do killed viral vaccines create an ovarian vasculitis that would interrupt cyclicity? And then along those lines, how close to a synchronized estrus can we use a killed viral vaccine?
That's an excellent question. So the data would suggest that killed viral vaccines in activated fractions of both herpes and BVD do not have the same ovarian disorders that the attenuated modified live strains do. And so I've seen studies that have used killed vaccines within 7 days of breeding. And I think that's some of the work of Dr. Perry, and actually shows very good pregnancy rates, good fertility. So very little impact on fertility with the use of inactivated fractions or vaccines containing inactivated fractions. And so, yeah, I think using them in that sort of group is important. And that goes back to the point, if as a producer or as a veterinarian working with producers, if you don't have an ability to work those animals prior to breeding, at least 30 days or potentially 45 days prior to breeding, and the only time you're going to get a vaccine into them is in that close time proximity to breeding, you still have to be careful with modified live and attenuated strains, and may want to err on the side of caution and use inactivated. You do suffer some loss in efficacy, depending on, with the data we have currently available, you do suffer some loss in efficacy. And, so there's options there. Does that answer your question?
Great, I think it does. Yes,
Yep.
sir. Thank you for that response. Let's go to another one here. I think it's an excellent question, and kind of looking more at efficacy. Any data on subsequent years of killed after a couple of those priming doses of modified live pre-breeding?
That's an excellent question. And so, to my knowledge, there are no data sets yet. I think people are looking at it, and there's different ways to look at it. Now, remember, we got to be careful looking at what are called surrogate measures of protection, right? And a surrogate measure of protection is looking at antibody titers. But I will tell you that antibody titers do help us gauge or guess a response. And so I know that there are some investigators looking at continued use of killed viral vaccines in the pregnant cow herd and then evaluating their antibody titers. And that's going to be some excellent data that we need. The real key, though, would be to take subsets of cattle and challenge them and really see whether we have that advantage. And what we may find is once we get those data sets, we may find that once every 5 years, we may want to come in and do a pre-breeding booster of the cow herd, of the mature cow herd with a modified live to re-stimulate some of that cell-mediated immunity and get some of our protection back. It kind of comes back, the inactivated vaccines provide that bolus of antigenic mass. And I think that is a wonderful thing to provide cattle after they've been primed with modified lives.